Hey guys, I got a comment on my post. Someone brought up hip flexors. So this is probably my number one muscle group that I have to work on when I'm doing therapy inside of a clinic. The hip flexor is one of the big strong muscles on your body, connects your lower half to your upper half. If you've ever had any issues with frequent urination at night, constipation, low back pain, just tight hips or inability to extend your leg behind you, all of these could come back to having a hip flexor dysfunction, which just simply means that your hip flexor has gotten tight and short and it's not lengthening back out. And what does that result in? Weak glutes. Glutes are the number one muscle you should be after in terms of support, strength, and definitely if you're having low back pain, you got to go after those glutes and abs. So to lengthen your hip flexors, we have a few different ideas. The one I posted to my video yesterday was laying on your bed and dropping your leg. So I was going to show you that one quick. You get into bed at home. All you have to do is lay down. You take one leg, you drop it right on. Your hip flexor is connected behind your belly button, and then it goes right down through your hip and connects down onto your leg. And so to stretch this muscle, you need to extend your leg flat, and then you need to take some good deep inhales and exhales. So breathe in. Breathe out. At the end of the exhale, you should start to feel that muscle stretch out. The other thing I added is if you can squeeze or contract your glute muscle at the same time, you'll intensify that stretch. So contract your glute, pull your leg up, now you're stretching out even more. If that's uncomfortable for you, another option is sitting on your side in this way. Now I'm going to be going after my left hip flexor. You start in this position, and if you just roll your pelvis forward, contract that left glute, you are now stretching your left hip flexor in a side-lying seated position. Option 3 is standing and using any sort of kitchen chair. All you have to do, put one leg up. Now I'm stretching my right leg because this leg needs to be extended to stretch it. And all you have to do is take your pelvis, pull it forward. As you pull this forward and tuck your tailbone underneath you and you contract that right glute, again, you're now stretching your right hip flexor. You want to hold these for much longer than what I just did, at least a minute if you want to get a nice long stretch throughout that muscle. It's big, it's tight. The longer you hold it, it will probably benefit you more. But there's lots of different things that you could be feeling if you have tight hip flexors. If you have any other questions or need some guidance going through this, call the clinic. I'd be happy to work with you. But thanks, guys.